Hi everyone, welcome back to my YouTube channel and today we are going to talk about magnetic resonance imaging. So let's start topic with introduction. Magnetic resonance imaging is a modern non-invasive medical imaging technique that is used to visualize internal structure of the body with high contrast and detail, especially the soft tissue. Unlike X-rays and CT scans, MRI does not use ionizing radiations. Instead, it uses strong magnetic fields and radiofrequency waves to produce images. MRI is particularly useful for imaging the brain, spinal cord, joints, abdomen, heart, and muscles. Principles of MRI. MRI works on the principles of nuclear magnetic resonance. Human body contains large amount of hydrogen atoms in the form of in water and fats. When placed in strong magnetic fields, the protons in hydrogen atoms aligns with the field. A radio frequency pulse is then applied, thus that causes the protons to temporarily move out of the alignment. When the pulse stops, the proton turns to their original position, thus releasing energy. This released energy is detected by a scanner and processed by a computer to create detailed images of internal tissues. Components of MRI are magnetic resonance imaging. An MRI scanner consists of magnet, radio frequency coils, gradient coils, patient table, computer system. Magnet creates a strong magnetic field. Radio frequency coils transmit and receive radio waves. Gradient coil adjusts magnetic field for image slicing. Patient table is for the slice the patient into the scanner and computer system reconstruct the signals into images. The scanner is shaped like a large cylindrical tube in which the patient lies still during the procedure. Procedure of MRI scan. The patient is asked to remove all metal objects because metal is affected by magnetic fields. Then the patient lies on the sliding table which moves into the MRI scanner. Radio frequency waves are transmitted and signals from tissue are recorded. The computer processes these signals to form high resolution cross sectional and 3D images. Then this scan is painless, but the machine may produce loud knocking sounds. Ear protection is usually provided in these cases. Some scans may require the use of contrast agent, usually gadolinium, that is injected intravenously to enhance image clarity of blood vessels and tumors. Types of MRI scans. First is T1 weighted imaging. It provides clear anatomical detail and in this fat appears bright. Second type is T2 weighted imaging. It is highlighted fluid and inflammation and water and edema appear bright in this case. Third type is functional MRI that measure brain activity by detecting changes in blood flow. Fourth type is diffusion weighted imaging that is useful for early detection of stroke. And fifth type is MR angiography that is used to visualize blood vessels without catheter insertion. Clinical application of MRI. MRI is widely used in many medical fields, including brain and nervous system, and it is done for the stroke detection, brain tumors, and multiple sclerosis and spinal cord disorders. It is also has application in musculoskeletal system to detect any abnormalities in ligaments and tender tears, joint injuries, bone marrow abnormalities. It also has application in cardiovascular system in finding out heart structure and its function evolution, blood vessel imaging, and then it also has application in abdomen and pelvis region for liver and pancreatic disease detection, uterine and prostate abnormalities detection, and tumor detection. MRI is especially preferred where soft tissue contrast is required. Advantages of MRI. There are no ionizing radiation, so it is safe for repeated use. It is excellent for soft tissue contrast and detail. It is useful for brain, spinal cord, muscles, and ligaments. It can produce 3D images, and functional MRI can measure brain activity. Disadvantages of MRI. In this case, they're expensive compared to CT and X-ray. It takes more time to perform. It produces loud noises during scanning. It is not suitable for patients with metal implants, pacemaker, or certain prosthetic devices. And this patient with claustrophobia may feel discomfort. Contraindication of MRI. MRI should be avoided or done with cautions in patients with pacemaker, cochlear implants, or metallic foreign bodies. In early pregnancy, contrast agents are avoided unless necessary. In patients that are unable to lie still. Conclusion of this lecture video. MRI is a powerful and safe imaging technology that provides highly detailed images of body tissue without using harmful radiations. Its ability to differentiate soft tissue makes it invaluable in diagnosing diseases of the brain, spine, joints, and internal organs. Although it is costlier and take longer than CT, the superior image quality and safety make MRI an essential tool in modern medical diagnosis. And this was all about magnetic resonance imaging. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.